My name is Leah Arsenault. I am an Oncology Nurse Navigator. It's a pretty new role for us at South County Hospital. I have been a nurse for about 28 years, but in oncology for the last 15, and really have learned to love that patient population. So the role is I am navigating patients through a diagnosis of cancer. So when someone is newly diagnosed, I am available to them, and I'm going to follow them all along. And mostly my job is to collaborate with them, make sure appointments are going well, to educate. A lot of times when the doctor's done talking to them, they have to come to me and go, okay, they told me this, this, and this. Am I completely understanding this? I'll introduce them to going to chemotherapy and what radiation is all about. If they have questions when they're at home, I'm the first person that they can call. So I don't want anyone going home and worrying about things. I want them to call me so that everything is going smoothly for them. Typically, patients are referred by my oncologist. And if they're having a visit with my doctor, I'm meeting with them as well. If we know early on, I can actually give them a call at home, introduce myself, explain kind of what the care plan is or what the plan is for them up to this point, and I'll meet them personally when they come into the office. What's interesting is the caregiver will always be the one that steps up to the plate because the person with cancer is so overwhelmed, they can't hear everything that's being told. And you'll find that the caregiver is the one jotting things down, asking the questions, making sure that they're supporting the patient at home. But of course, once they're at home dealing with everything, it's quite overwhelming for them as well. So we wanted to start a caregiver group where they could come and talk about all those stressors and find the support that they need. South County Hospital has a lot of support. We have mental health workers and social workers and nutritionists and physical therapy. And sometimes we find that our caregivers also need all of those things. They need to be cared for as well during all of this. I think one of the strengths of the role of the navigator is education. Patients think they understand things that are being said, or they think they understand about the medical angle, and it's really important that I'm finding out what they understand and really helping educate them because the more they understand, as well as the caregiver, the more they understand about what's happening, the easier it is for them. So education is a real important part of the navigation. One of the important things that a navigator does is deal with the financial issues, which can be quite stressful in the time of being diagnosed with cancer. So we are very proud to have a wonderful, strong patient family advocacy program or financial advocacy program. So I can always refer patients to that early on. I also spend a lot of time working with organizations to pay for medications and some of their care. So a lot of that coordination can be done through me and taken out of the patient's hands.